Hello everyone. So a hair transplant surgeon's biggest challenge is taking care, or let's say restoring the hair for advanced baldness, what we call grade 6 or grade 7 baldness. Because in such cases, usually the bald area is very big, the patient's age is usually advanced, and the donor area is very limited. So because of these reasons, limited donor area and a very big area to cover, hair transplants becomes a challenge. What are the options for a patient with grade 6 or grade 7 hair loss, baldness? So what are his options? Number 1, just accept it. 2, go for a wig, or you get a hair transplant done at Medlinks or any other good place which is experienced in managing these advanced cases. When you see hair transplant results, you research about it, you see it on YouTube, social media, mostly you see grade 3, grade 4. These are the most common let's say severity of baldness or grade of baldness that opt for a hair transplant. Most of our patients are grade 3, grade 4, 25 to 35 years of age. But there are many times when advanced grade patients who are grade 6 and grade 7 who come to us seeking a natural solution for their hair loss. Nobody wants to wear a patch. So we have been operating on such cases since a very long time, and we know how to tackle these cases. So in this video, we'll be discussing with you on what is Medlinks approach, how we approach such advanced case baldnesses. And when we say advanced case baldnesses, it is usually patients with such big area. This is the typical grade 6 advanced baldness wherein we have such a big area to cover. This is the front view and then this is the back view. And as we were discussing, in such patients usually we have very limited donor area. So that's the challenge. Limited donor versus a very big area to cover. So in such cases, we offer multiple options, and that is what we'll be discussing with you today. So number 1 is a combination of strip FUT hair transplant with perfect eye, wherein we get more hair. Many times patients clearly refuse doing an FUT because of more invasive nature of the procedure. Then we do perfect eye only, where we take hair from the scalp, we take hair from the beard, facial beard, body hair, even pubic hair at times, and we mix all these hair to give them approach. And then sometimes we combine a hair transplant with a wig, hair transplant for the frontal area and a wig for the back areas, so that it gives us the best of both the worlds, the density of a wig on the crown and the naturalness of the hair transplant in the front or the hairline. So this is how we approach such cases. So now, as we were discussing, in such cases the procedure is very big. We have to cover everything, and thus we take a lot of hair from the beard. This is the most preferred beard area because this is a shadow zone, usually not directly visible. So even if the person does not grow a very beard, it's not very noticeable. But many times, because of the sheer number of the grafts, we take hair from the facial beard also. But when we take hair from the facial beard, we are not very aggressive. We take only 20 to 25%, which means if we take one, we leave 3 to 4 hairs, so that not everybody can shave every day. So even if you are not shaving, even if our patients are not shaving for 3 to 4 days, it does not look odd. Whereas when we take from the below the jaw, this part of the area, we are a little more aggressive because this is usually not visible. Well, somebody like me who has a big double chin, it may be visible, but with most of our patients, this area is not that visible. So this is the main area where we extract the beard from, and then in some cases from the facial beard also. Then this is what we usually get. So this is a young patient with advanced grade hair loss, wherein we did a transplant in a single go. And single go means 2 consecutive days, day 1 and day 2, and this is the outcome. We use certain tricks, we use certain planning when we are approaching such a big area, and this is called density gradient. We can't give a high density everywhere because we do not have those many numbers. We do not have 30 or 40,000 grafts that we can transplant. We have limitation. We have 6,000, 7,000, sometimes 8,000 grafts at our disposal, and we have to manage in this number. We are restricted. So what we do is this. So of course we have to use the resources very smartly. That's where density gradient comes in. We'll come to that. Second is we go to non-scalp donors. Non-scalp donors means anything other than the scalp, which is number 1 is scalp donor. So that's done. Number 2 is the neck part of the beard, as we just discussed. Number 3 is the facial beard. Number 4 is the pubic area, and then comes the body hair, chest hair, back hair, sometimes leg and hands hair. But these are rare. Most commonly we use scalp and beard hair. Or we ask the patients to do the procedure over 2 sessions. First, you go for a low density overall, and then you come back to us after 15 or 18 months, wherein we can increase the density. We can again take a bit of hair from here and there and just increase the density. Medlinks is one of the few clinics that is doing a combination of FUT and perfect eye hair transplants, wherein we maximize the scalp donor. We'll discuss this later in the video. Hybrid means we use a patch or a wig also over the crown area, and the frontal area we do a hair transplant. So we are combining best of both the worlds, the density of the patch and the naturalness of a hair transplant. And of course, we add medical treatment, we add some more density illusions through a procedure called scalp micropigmentation. So this is a representation of how we approach different areas. So let's say we are doing only a perfect eye hair transplant. We have restricted number that is available. We have, let's say, around 6,000 grafts that can be done. So this is the density gradient that we use in our grade 6 patients. So the most important is the hairline zone. Hairline zone is what is directly visible from the front. The front 2 centimeters of your hairline, that is what we call the hairline zone. That is going to be visible from the front, that is going to frame your face. So this is the area where we do not want to make any compromise, and we go with high density, that is 40 to 45 grafts per square centimeter. Because hairline, in my opinion, is the make or break of a hair transplant. If hairline is natural, adequately dense, and even if you have less hair at the top, you can manage by combing, you can manage by the illusions like SMP or hair fiber that we are going to discuss later. But you can't hide your hairline. So hairline is something that we do not want to make any compromise. So that's where we go for a high density. Second is the forelock area. Forelock area is the next 3 fingers broad area behind your hairline. So this is the forelock area, and here we go with the medium density, something like 25 to 30 grafts per square centimeter, because this is also an important area in overall combing. Because if you just have good hair in the front 2 centimeter and very scanty hair here, then combing it becomes very, very difficult. But with this plan, the hairline hair, the hair that we have used on the hairline, they get good support with the forelock hair. So the overall combing becomes easy and becomes very, very manageable. So the second priority is the forelock area, where we go with a medium density 25 to 30 grafts per square centimeter. Then comes the mid scalp. Now mid scalp is something what we call the sandwich zone, or something which is hidden, this area. Now mid scalp can be covered by combing. It is not directly visible either from the front or from the back. It's only visible when somebody is seeing from the top. And despite that, the hair that comes from here, you can comb in this way. Hair that comes from the back can be combed in the front. So everything merges here, the junctional area. So in the mid scalp, we try to save hair. We don't want to go with a density of 30 grafts per square centimeter on the mid area, because we have limited donor. That's what I said, smart use of resources. So this is the area, mid scalp area, where we go less in density. And then come the vertex area, the second line of vision. There again we increase the density a bit and give a density which is equal to the forelock, that is roughly 25 to 30 grafts per square centimeter. So this is the plan. This is the plan that we use when we are approaching grade 6 or grade 7 hair losses. Highest density on the hairline, followed by forelock, followed by the vertex, and least density in the mid scalp, so that once the hair grows over the next 9 to 12 months, the patients can comb it nicely, and it gives a nice aesthetically pleasing look, and it looks reasonably full. So this is a good picture where you can appreciate this density gradient. Let me explain it to you. So this is the hairline zone that I was talking about. Here we go with a density of 40 grafts per square centimeter, and we use only scalp hair, because not only we want density, but we want naturalness also. So no body hair, no beard hair in the hairline zone, only scalp hair. This is the forelock area, where you will see the density is slightly less than the hairline zone. Here also we prefer to use only scalp hair, because we want a good overall combing, a very nice front look. Here we go with a density of 30 grafts per square centimeter. Then comes the middle scalp. Here, if you see closely, the space between 2 grafts is more, the density is less, that's around 15 grafts per square centimeter. And Here we use scalp and beard mixture. Sometimes we use more beard than scalp hair because this is the area which is not in line of vision, neither from the front nor from the back, and the patient can comb over. So this is the area where we save grafts. And then comes the vertex area, where the hair are in the whirl direction. Here again we try to use as many as possible scalp hair only, maybe 80-20 ratio, 80% scalp hair, 20% non-scalp hair. Again the density would be slightly higher than the middle scalp because this is the second line of vision, and because of the whirl there is always some see-through. So we do not want to make a lot of compromises there. So again slightly higher, 25 to 30 grafts per square centimeter density on the vertex area. So this is what we usually achieve when we are taking, when we are working on this smart plan, wherein on the front we have used higher density. As you can see, this area has received lot of hair, soft hair, mostly scalp hair, and the density is more, versus the middle scalp where we reduce the density, and again the crown area, this part, where we increase the density slightly so that it's okay. It's not great like the front, but usually reasonably well covered. Coming on to beard extraction. Many patients, when they first hear us tell that, okay, we are going to take hair from your beard area also, it gives a shock to them. Is it even possible that you take beard? Won't it hurt too much? Won't it leave scars on my face? Well, yes, if it is not done properly, if I use a very big punch, if I don't give my anesthesia properly, it will pain and it will scar also. But when you do it properly, like what we do at Medlinks, we give first of all topical anesthesia, we apply a numbing cream, then we give very micro injections of anesthesia at the strategic points so that this entire area is numb, and this is where we take out the hair from. Depending on how many hair we need, depending on what style of beard the patient is going to keep in the future, we plan our extraction. So in this example, the patient likes keeping a beard, so we did not take everything. We scattered it across, just like what we do from the scalp. We take one, we leave one. We take one, we leave one, or sometimes we leave two. So these red dots that you are seeing here, these are the extracted follicle, and you will see, if you see closely, there are a lot of hair which are left. So they regrow. And this is the same patient after about a month of his beard extraction. So if you see closely here, see this area versus this area here, the density has gone down because the hair that we take out is not going to grow back, but it's still looking okay. There's still no scar marks here because we have taken out with a plan that the patient wants to keep the beard. So we have not taken out everything, and because we have used very small punches, the area does not show any scars, no white dots. We do a lot of patients who have slightly, type 4 or type 5, slightly darker skin tone. Even in those patients, we do not get these white or what we call hypopigmented dots because the punch size that we use for the beard is 0.6 millimeter, which is a very small punch. The skin heals very fast. Within 3 days, the wounds have healed. So the scarring is absolutely not noticeable. So this area here, this is an old scar. This is not a scar because of the transplant. This is a scar that the patient already had.